6 early signs of dementia you should not ignore. Dementia is a progressive neurological disease affecting approximately 55 million people worldwide, making it the leading cause of deterioration and dependency among older adults. Although many people associate dementia with aging, this disease develops decades before any symptoms appear. Detecting early indicators can help limit the disease's progression and promote long-term cognitive health. Below are 6 early symptoms of dementia that often go unnoticed. Postural changes. Subtle changes in gait, coordination, and balance may indicate neurological problems. Shorter steps, shuffling feet, and difficulty using utensils are warning signs. Sensory problems. Dementia can affect depth perception, spatial awareness, and the sense of smell. Increased sensitivity to noise or hearing loss is linked to a higher risk of cognitive decline. Muscle weakness. According to studies, older adults with weaker grip strength are more likely to develop dementia in the future. Sleep disorders. Warning signs may include insomnia, excessive daytime sleepiness, frequent nightmares, or restless movements during sleep. Apathy and social withdrawal. A loss of interest in hobbies, social events, or family gatherings may indicate emotional changes caused by dementia. Difficulty finding words. Aphasia, or difficulty remembering common expressions or misnaming objects, is often one of the earliest visible indicators of Alzheimer's disease. Early recognition of these warning signs allows for preventive measures such as brain stimulants, exercise, good nutrition, and adequate sleep. There are many elements that can help slow cognitive decline. Early detection is crucial for managing symptoms and improving the quality of life. Postural changes. When movement tells a story, changes in posture and gait are sometimes natural characteristics of aging, but can also be early indicators of dementia. The brain is responsible for balance and coordination, and as cognitive functions decline, motor control is also affected. Individuals may begin walking with shorter steps or shuffling their feet instead of lifting them properly. Balance issues can lead to frequent trips and difficulties navigating familiar spaces. Coordination problems may also occur, making simple tasks like holding a cup or using utensils challenging. Loss of motor control can result in slumped posture or leaning to one side. These small changes may not seem worrisome at first, but can accumulate over time, limiting movement and increasing the risk of falls. Sensory issues. How the brain perceives the world. Dementia doesn't just harm memory, it can also interfere with sensory perception. The brain processes information from our senses, and as neurons degenerate, those affected may struggle with depth perception, including judging distances, pouring liquids, and climbing stairs. Spatial perception issues, such as getting lost in cluttered spaces or frequently bumping into furniture, may occur. Dementia, particularly Alzheimer's disease, can cause early loss of smell and taste. Hearing loss and noise sensitivity are also possible. People may struggle to identify voices in noisy environments or experience hypersensitivity to loud sounds. Hearing loss in middle age is closely linked to a higher risk of dementia, according to research. Untreated hearing loss forces the brain to work harder to interpret sounds, potentially leading to cognitive fatigue and memory loss over time. Muscle weakness, a warning from the body. The link between muscle strength and cognitive health is often underestimated. However, studies have shown that weak grip strength in older adults is strongly associated with a higher risk of dementia. Reduced ability to open jars, carry groceries, or securely grasp objects may indicate early neuronal disruptions. Muscle mass loss and general weakness increase the risk of dementia. Weakness in the arms or legs can reduce physical activity, accelerating cognitive decline. Physical exercise and strength training have been shown to preserve brain function. Maintaining muscle health can help prevent the progression of dementia-related deterioration. Sleep disorders, an early and crucial warning sign. Sleep disorders are both a symptom and a potential cause of dementia. While many older adults experience changes in their sleep patterns, certain disruptions may indicate underlying cognitive decline. Excessive daytime sleepiness. Individuals may feel overly tired and need frequent naps, insomnia and fragmented sleep, difficulty falling asleep, frequent waking, or early rising without feeling rested. Involuntary movements, kicking, punching, or talking during sleep may suggest REM sleep behavior disorder linked to Lewy body dementia. Intense nightmares and night terrors may indicate brain abnormalities. Poor sleep promotes brain inflammation and worsens cognitive decline. Treating sleep disorders early can help preserve long-term brain health. Apathy and social withdrawal. Losing interest in life. Apathy is sometimes mistaken for despair or normal aging. However, it is one of the earliest emotional signs of dementia. People with cognitive decline may lose interest in hobbies, work, or social activities they once enjoyed, reduced social interactions and engagement, reacting less emotionally to happy or sad events, showing a lack of motivation to initiate work or daily activities. This emotional detachment occurs when dementia affects the brain's ability to regulate emotions and social interactions. While depression and apathy may seem similar, apathy and dementia tends to be persistent and unrelated to external factors. Difficulty finding words, struggling with communication. One of the most well-known early signs of dementia is difficulty communicating. Aphasia can manifest in various ways, struggling to recall simple words or using incorrect terms, such as shirt instead of jacket. Frequent pauses during speech due to difficulty finding the right phrases. Involuntary repetition of the same words or phrases. Forgetting familiar names, including those of close relatives. Aphasia often develops years before a dementia diagnosis and can worsen over time, making communication increasingly difficult. What to do if you notice these signs? If you or a loved one exhibit early indicators of dementia, seek medical attention as soon as possible. Early intervention may include ruling out other potential causes of similar symptoms, such as vitamin deficiencies, thyroid issues, or stress. Accessing medications that can slow cognitive decline, allowing individuals and families to plan for the future and make necessary lifestyle changes. Steps to protect brain health. While there is no cure for dementia, research shows several lifestyle choices can significantly reduce risk. Engaging in cognitive activities, such as learning new skills, solving puzzles, and practicing multiple languages to build cognitive reserve. Regular physical exercise stimulates blood flow and neuroplasticity. Mediterranean and Mind diets emphasize healthy fats, antioxidants, and lean proteins to support brain health. Managing chronic conditions such as diabetes, hypertension, and cholesterol can reduce dementia risk. Promoting deep sleep helps eliminate the chemicals responsible for neurodegeneration. 10 classic symptoms of dementia you should not ignore. Dementia is a progressive neurological condition that affects memory, cognitive abilities, and daily functions. While early signs may be subtle as the disease progresses, more pronounced symptoms emerge that impact a person's ability to communicate, navigate familiar situations, and maintain independence. Recognizing these typical signs can help individuals and families seek medical attention promptly, allowing for better symptom management and improved quality of life. Memory loss. Forgetfulness is not limited to names and dates. It is one of the most common symptoms of dementia. However, it involves a consistent loss of short and long-term memory. It includes forgetting important appointments, repeating the same questions, or retelling the same story multiple times. Over time, this memory loss can interfere with daily life and work. Difficulty completing familiar tasks. People with dementia may find it challenging to perform routine activities they once managed effortlessly. This could include trouble following a favorite recipe, handling finances, or even getting lost while driving to a familiar location. These lapses go beyond simple absent-mindedness and indicate a deeper cognitive issue. Confusion with time and place. Losing track of dates, seasons, or the passage of time is another early sign of dementia. Individuals might forget where they are or how they got there. struggling to understand events that are not happening in the immediate moment, problems with visual and spatial relationships. Vision problems can be an early symptom of dementia, making it harder to read, judge distances, or even distinguish colors. This can lead to accidents while driving or difficulty navigating around furniture and objects. Challenges with speaking or writing dementia can cause individuals to struggle with words in conversations or writing. They may pause frequently, lose their train of thought, or repeat themselves. Finding the right words to name objects or express ideas can become frustrating and time-consuming, misplacing objects and losing the ability to retrace steps. It's common to misplace keys or glasses occasionally, but individuals with dementia may put objects in unusual places, like leaving a wallet in the refrigerator. Over time, they may also lose the ability to retrace their steps to find the misplaced items. Decreased or poor judgment. People with dementia may exhibit poor judgment or decision-making skills, such as falling victim to scams, spending money irresponsibly, or neglecting personal hygiene. Withdrawal from work or social activities. Apathy and social withdrawal are common in dementia. People may lose interest in hobbies, social gatherings, or work tasks. This disinterest can stem from difficulty following conversations or keeping up with others. Changes in mood and personality. Dementia can alter an individual's personality or mood. They might become confused, suspicious, depressed, fearful, or anxious. Someone who was once outgoing may become withdrawn, or someone typically calm may become irritable. Increased difficulty adapting to change. Fear of new experiences or changes in routine can set in as individuals struggle to understand what's happening around them. This difficulty adapting to change often leads to a preference for familiar environments and routines. What to do if you notice these symptoms? If you or someone you love exhibits early signs of dementia, seek medical advice promptly. Early diagnosis can help. Rule out other conditions with similar symptoms, such as vitamin deficiencies or thyroid problems. Access medications that can slow cognitive decline. Allow families to plan for the future and make necessary lifestyle changes. Steps to protect brain health. While there is no cure for dementia, research shows that specific lifestyle choices can significantly reduce the risk. Engage in cognitive activities like learning new skills, solving puzzles, or practicing multiple languages to boost cognitive reserves. Regular physical exercise promotes blood circulation and neuroplasticity. Follow a Mediterranean or MIND diet rich in healthy fats, antioxidants, and lean proteins to support brain health. Manage chronic conditions like diabetes, hypertension, and high cholesterol to lower dementia risk. Prioritize deep sleep, which helps eliminate the chemical buildup associated with neurodegeneration. By recognizing these signs and taking proactive steps, individuals can preserve cognitive health and maintain a better quality of life for as long as possible. Dealing with signs of dementia can be frightening, but remember, information is your greatest ally. The earlier you recognize the symptoms and seek help, the better your chances of maintaining a good quality of life for yourself or your loved ones. Now that you know the 10 early signs of dementia, we'd love to hear from you. Have you noticed anything similar in someone close to you or even in yourself? Share your experiences in the comments. Your story could help others identify these signs in time. And don't forget to take care of your mental health. Adopt healthy habits, keep your mind active, and build a support network with family and friends. Together, we can face any challenge. If this content was helpful to you or could help someone going through this experience, don't forget to like, share, and leave a comment. We'd love to hear your thoughts, and if you need support, we're here to listen to your story. Together, we can transform a challenging moment into an act of love and understanding. Thank you so much for watching, and see you soon.